All right, so today I want to be a little bit more specific. I'm going to talk to you about back pain specific to the discs. You got back pain, you go to your doctor. Typically, you're going to get an MRI. That's where you're going to see what's going on in here. You might see a bulge, you might see a herniation, you might see some form of degeneration from that MRI. So I'm going to show you what that does. I'm going to give you some options on what you can do. So the bones look like this. You've got the nerves that go through each one. When the disc is in its proper position, it's open like that. The nerves are fine, but it can compress down. You can pinch on the nerve. You can get a bulge, a herniation, or a full blowout like this. Those are all bad. They're not ideal. They will cause pain. What do you do about that? You need a little bit of a different approach. The soft tissue is the discs and the nerves, but we have to look at the bones. We have to look at the alignment. We want to take x-rays and see what it looks like, where you're standing, how it's moving. Those traditional approaches, the drugs, the surgeries, and the medications, if that doesn't work for you, or if you're not interested in that, come see us and see what we can do. We can take a much more conservative approach, and oftentimes we can fix these problems and we can get great results. So let us check it out. Let us see what we can do, and let us see if we can help.